Hi, this is Jacqueline, and I'm back with my next video. So I know it's been a very long time since I've posted a video, and this video actually is from a few months ago. A friend of mine that I actually met through this channel, Daniel, reached out to me to do a Zoom call with other people that were suffering from long COVID. So we did a Zoom call, and I asked for their permission to post the call onto the channel so that other people could also benefit from the information that was shared. We talk about symptoms, we talk about treatments, we talk about potential causes of long COVID. So the video is very long, it's about an hour, but if you have questions or you just want to hear some of the information I have to share, if you put on your AirPods, go for a drive or cleaning or something like that, you might get some good information out of it. As always, if you have any questions or comments, post in the comment section below, and hopefully if you do watch the whole hour or listen to it, that you get some good information. Otherwise, I have been doing well. I don't really have any updates to report on my own health. I am very grateful that things have been pretty steady for me. And again, I have been thinking about all of you. I always think about the long COVID community, and I hope and pray that treatments will be available to everyone very soon. For now, and as always, peace and enjoy. Thank you.
Our first question was if you can just tell us a little bit about yourself, like what are you doing? What were you doing in your life before long COVID happened? Before everything, what kind of person were you? We're just trying to understand, were you an active person like most of us? Just trying to understand what were your life before everything happened.
Right. So, well, first of all, hello to everyone, and I hope that you find this helpful. All I can do is speak from my own experiences. I don't have any medical degrees or anything like that, so this just comes from what I've learned, my research, my experience. So prior to COVID, I actually owned a gym. I was co-owner of a CrossFit gym. I don't know if you're familiar with CrossFit, but it's pretty intense workout, lifting, cardio, the whole shebang. I was working out 5 days a week. I would say, in the best physical shape of my life, 2018, 19, and 2020. I have always been very active. I danced as a child. So yeah, always going to the park with my kids, running around. I didn't miss a beat. Wake up, go work all day, go to the gym, clean, get my kids. So I was just, yeah, extremely, extremely active. So, and that seems pretty consistent with everybody, waking up, going to parks, walking to the parks with my kids, playing all day with them. So yes, extremely busy, extremely active.
Extremely multitasking and 24/7
Mm-hmm.
yeah, with full energy.
Right. Yeah. I would say, generally I've always been someone that's needed about 8 hours of sleep. I never functioned great off of, 4 or 5 hours of sleep like other people could. But if I got 8 hours of sleep and was rested, even when I had my children and I was up in the middle of the night, I was still working out and, active. So yes, I didn't have any limitations at all or any health issues.
Yeah, sounds familiar. We missed that. And then what happened?
So then I did get COVID in 2020. At the end of the year, I did recover from the infection. I felt perfectly fine. I went and got Moderna. It wasn't my choice to get that vaccine, but was what was offered. I was in healthcare at that time. I was not mandated. I don't know where, what it was like where you guys live, but I was living in California. It was very much everyone needs to get vaccinated right away. You're never gonna get COVID again if you get the vaccine, and it's gonna go away if everyone does it. And it was like a lot of fear mongering and a lot of, we have to do this collectively type thing. And so I went and I got the first Moderna shot. I felt pretty bad for about a week, but it lifted because that one's the 4 week. You have 4 weeks between you get the first one and the second one. So for a week, I was kind of down, just like really, really tired, a little nauseous, stuff like that. Then for 3 weeks in between, I felt 100% normal, at the gym, active, nothing. And then after that second shot, it was just like, that's when things just went completely haywire for me.
So how long passed since your long COVID, since you were sick with coronavirus until you got the first shot? Was
It
it like
was only like a couple of months. So it was very shortly afterwards. Yes, which was not smart on my part either, that I got it so quickly. And I think that's maybe part of the reason why I had such a terrible reaction to it. But like we didn't know, right? I mean, we didn't know that, oh, okay, you had it. You probably don't need to ever get a shot if you've already had the virus. So
these were the instructions in our country? These were the instructions as well. I think
We were actually the first country to try the Pfizer trials. So we were the first in the world to get all 3 shots. And
so,
yeah, it's not spoken
Mhm.
much, but a lot of us got long COVID, and we think that it's like the immune response, the immune dysregulation at this point. You can be sick with COVID and get the shot, and it will drive the immune system to do what it does. And this is what is long COVID, in our opinion, at least.
So can you differ the symptoms? I mean, what you felt after you were infected with coronavirus and after you've taken the vaccine? Did you feel different things? Were you suffering from different side effects? Or was it like worsening the stage that you were in after you were infected with coronavirus?
Well, after the COVID infection itself, like I had felt that I had recovered from COVID. So I wasn't having any symptoms when I got the vaccine. I was back to normal activity. Then after the vaccine, it started with heart palpitations, shortness of breath, like that they call like derealization. Like you feel like you're kind of in a haze, like you're not really sure, like you almost feel like things aren't real, like you're living in a smoky room almost, and it's just this like weird haze feeling, and a feeling of just sick, like unwell, feeling like I drank poison and was just felt like icky and yucky and not myself. That's probably the best way to describe it. I was extremely tired. So those were the symptoms after the vaccine. Then I had a reinfection after that. So I don't know if there's anything you want to ask in between that, but the reinfection set off a whole different slew of symptoms. And then it just like escalated. And that's when I was probably at my worst health, was at the end of like mid 2021 through the end of through into 2022 was when I was at my absolute worst.
As if your reinfection were like second vaccine, actually.
It's all immune dysregulation at this point. We all understand that there's an immune dysregulation caused maybe by the spike protein. We can't give the stamp on that, but it probably is caused by the spike protein at this point. And this can be caused from infection, and this can be also caused from the vaccine. So there are people who actually have some sort of long COVID after the infection without the shot.
Right.
They didn't get any shot. So it's all the same thing around this specific protein, which dysregulate the immune system.
Right. So, I mean, I think that's all true. I think you can have long COVID from COVID itself, and you can have long COVID symptoms from just a shot. And then I think the worst case scenario, which is both, right? You have long COVID and then you get the shot, and then it's like everything's just made so much worse because of the shot. So I mean, I believe all three can exist at the same time. For me, I mean, I will never know, but I don't think I would have got long COVID had I not been vaccinated. I think that's just what set off immune dysregulation. When I came in contact with the virus again, I was like my immune system was completely haywire at that point. And I don't think I was able to clear the virus. Like I felt like I still had COVID for months, like acute COVID, even though like tests would say, negative or whatever. At that point, it was somehow, I don't know, replicating, whether they say in your tissues and your organs or whatever. I felt like I still had COVID. And that was when I was infected in summer of 2021. And then that set off like horrible GI issues. So that's when like my GI system, like I couldn't even eat. My stomach was just, I felt like I was like always having really bad abdominal cramping, abdominal pain. And then that's when the Epstein-Barr virus, I knew that I had Epstein-Barr. I just was exhausted. So I went in and was tested. It was reactivated. And then that's when I felt like almost like skin crawling. Like I almost felt like I could like just like come out of my skin. And I was very depressed. I was crying like just all the time, just like crying, like just this emotional wreck. And like, it wasn't because of my circumstances. I mean, it was, but it was because your brain's affected, right? Something's going on, whether it's inflammation in your brain, but it's like your brain, you can't control your emotions. I mean, I would be at work and at lunch, I would cry for an hour and then I'd be like, okay, I got to go back to work. Like I was like living just like very robotic lifestyle at that point. And that's when I was very, very ill. And that was in the end of 21.
Can you share your diagnosis? I mean, were you diagnosed with neurological issues, pneumonial issues?
I was not diagnosed with anything.
Absolutely
actually.
nothing. There's nothing.
No, I mean, I was diagnosed with Epstein-Barr. Just
Okay.
EV, that was it. And I did all the heart, I did a heart monitor, I did an echocardiogram, I did EKGs, I did chest x-rays, everything was coming back fine.
Everything is fine. Yeah.
You
We
suffer
all,
from burning
biopsy?
sensation, Jacqueline, can I ask you if you suffer from burning sensation and from something in your veins?
nerve pains.
Like very, very minor. That was definitely not a significant symptom of mine. It may like have flared up after the vaccine a little bit, but that wasn't something that was with me long term. Like the long term was really the GI issues, heart rate issues, the depression, the anxiety, that kind of stuff. Like I didn't have, like, I wasn't forgetful in the cognitive sense of like people who can't remember things or can't read. I never went through that. I went through more of just like intense depression, intense emotion. So I felt like something wasn't right with my brain, but I don't really know what that was.
At this point, we kind of know what it was because we
Right. At that time, though, I'm like, why am I a complete disaster, about everything? Like I couldn't even talk and I would just like cry. So it was more like an emotional thing than the cognitive thing of, like I was able to go to work. I could read something. I could respond to something. I never lost words, I didn't have any of that like kind of dementia type things that I know people are experiencing.
That's interesting. I wonder if it's because the difference between Moderna and Pfizer, because here in it, we have got the Pfizer vaccine. Small fiber neuropathy is something many of us
we all
suffer.
have fiber neuropathies.
Yeah, we did biopsies. They came out positive. Brain fog and short-term memory loss is very common among us. Cognitive issues are very common among us. So that's interesting. Guys, is there anything else you want to ask Jacqueline regarding the symptoms, or can we go on to the treatments? Okay. So we would like to ask you, which treatments did you try before the stem cell therapy? Because I was also watching your YouTube channel. Thank you for all the information. I find it very helpful. So if you can just have a review or what you can tell us about the things you tried in order to make yourself better before the stem cell therapy.
So yeah, there's so many things I did and I have so many things overlap. So I know sometimes it can be a little confusing to follow, but basically in fall of 21, I was in a Facebook group. And there is that, I never did the protocol, the Incel DX protocol. I don't know if you guys are familiar with that. It's Dr. Patterson. He does like the Maraviroc and the statin. I never did that. I didn't feel that was right for me. It was just instinctual. There was nothing like I could say good or bad about the program. I just didn't feel it was right for me. But I did end up in that group. And in the group at the time, there was talk of monoclonal antibodies that perhaps that we haven't cleared the virus. So if we could get monoclonals, that they could come in and take the viral load down. So at that time, I found somebody that was willing to do it for long COVID. It wasn't recommended for that. He wasn't advertising that because obviously, I mean, that's going against the approved use of it. So I did go and see him. So this was October 21. And after the monoclonals, I noticed a huge difference. However, I was told by him, look, if you don't get the right amount, like the virus can rebound basically, like Paxlovid. If you don't take enough of it, the virus is still there. So I took it. I felt, oh my gosh, I feel like I'm starting to feel like a human being again. I'm not like the depression's going away. Things are getting better. But after about 4 to 5 weeks, it was like a rebound. So I did another set of monoclonals. And that was at the end of 21. And then that's when I also did EBU. So EBU, you know, they kind of clean out your blood. So the thought was that if you did that, there's filters and that maybe it could help filter out the spike protein. So I did
EBU is ozone therapy, right?
I do ozone regularly now. I didn't do ozone then. EBU is a little bit more advanced than ozone. It runs your blood
Like
through a filter.
apheresis?
It's in between. Ozone, yeah. Plasma apheresis is a little bit more intense. This is like sort of in between the two. So, but the premise is that yes, if you're cleaning out your blood almost and you're getting rid of spike protein. So I would say I felt that if I would have had the appropriate amount of monoclonals, then maybe I would have been able to wipe this thing off completely. But because, you know, we didn't know, we were just guessing, right? So like, we'll give you a dose of monoclonals, we'll see what happens. So after the monoclonals and the EBU, this puts me into early 22. And I do feel that both of those treatments helped, but I still didn't feel like I was recovered yet. Like, if that makes sense. Like, I felt like it took the load down. I felt like it took a weight off me. I felt like, okay, I can function better. I was having better days, but I wasn't consistently well at that time. And then that's when I had decided to do stem cell.
So yeah, that totally makes sense. We can understand what you mean, unfortunately, from trying all sorts of things. So how did you actually hear about the stem cells, and how did you decide that it would be helpful for
Stop for a
you?
moment because you've said some important things. As we all agree that there's an ongoing immune dysregulation, and before we move on to the stem cell therapy you said that monoclonal antibodies tremendously help you. So that's something that we should pinpoint because that's another thing that triggers an immune response, which might fix something in our immune dysregulation at this point. And maybe on top of that, doing stem cells can complete like the job, I would say, because those stem cells are basically mesenchymal stem cells are they're medicinal signaling cells. They should regulate the immune system, and the what you did with the monoclonal antibodies could have pushed that, and then on top of that, doing stem cells also could have done something, and then maybe when you mix both of those therapies, it can do something to our problem, our immune dysregulation. Now we can move on because I wanted to pinpoint that it's very important to notice everything that can change the immune system and change the response of the immune system. Yeah,
right.
you can move.
Right. And I think that that's one of the difficult things is that, you know, I did do multiple things. You know, I wasn't in a clinical trial where I just do one thing and I can fairly assess, oh, this absolutely did this. There was a lot of overlapping. There was a reinfection. There was Epstein-Barr. So like so many things are kind of overlapping, I guess.
Where have you done, by the way, the monoclonal antibodies? Because we can't get it here. I don't think that we have monoclonal antibodies here.
Well, right now they're really only available like through concierge services. So like the doctors that come to your house that do IV therapy. I don't know of any hospitals or any places like that here that have them. So it's just like called drip hydration, the concierge, LA, like those places still have them. But I mean, they are older at this point. They're the ones that came out in early 22. So I don't know how much the virus has mutated really since then. I don't know how effective they are currently, and I don't know how well they work for, like, were you all like around about infected around the same time? Like around like the originals, the original Alpha and Delta, or are people a little bit later than that?
I was
We are a lot
probably
of both. I mean, some people were infected in the first wave, the alpha. I don't remember if September 2020 was alpha or delta. I was infected on September 2020, and then half a year after that, on March 21, we were vaccinated. Stigal, were you infected
I was first vaccinated
and then
on
infected?
February 21, and then I was infected on January 22, a year
It was
after. And after the
Omicron.
infection, all the burning started, because before I had different symptoms. I have a joint pain, a heartbeat, but after the corona, like 3-4 weeks after the corona, I start to feel the burning all over my body.
Okay.
Yeah.
Yeah, so I mean that's just a hard thing about the monoclonals, because originally it was like called bamlanivimab or whatever, and then there was Regeneron. Regeneron was kind of for Delta, and then batilavimab was what was for Omicron. So there was like different monoclonals that have been available. The original ones we can't get here anymore. We can only get the very last ones that were made for Omicron. So I don't know like how effective they would be right now for people who were, who got COVID 2 years ago. For an acute infection, I would probably still do it here, but for long COVID, I don't know. That's always hard to say, but there are trials going on here in California for monoclonals for long COVID. So, I mean, we'll see what kind of happens with those trials and if they are able to tailor a monoclonal to help people with long COVID.
Where in California are they doing it? Do you know where?
I think it's UCSF, San Francisco.
UCSF.
Mm-hmm.
By the way, I did my apheresis in California in Santa Rosa.
Oh,
Apheresis
okay.
treatment. I did 10 treatments there, like 6, and then after a few months I came and did another 4. And after the first 6, I also took embryonic cells, stem cell, a shot, which I think was good.
embryonic cells.
Yes.
But it seems like the apheresis do not. Maybe it reduces the amount of spike protein in the blood, but it do not change the symptoms or drive healing processes.
Exactly.
So now we can hear what we really want to hear about the stem cell therapy.
Yeah, we can move to that.
In which you have the most experience, I think, in that on yourself.
Yes. Yeah, I mean, I've had quite a bit of treatments, and mainly the reason for so many treatments is the reinfections, really. I don't know that I would have had to go back had I not been reinfected. So that's sort of what, and then for maintenance, the last 2 times may not have been completely necessary to go, but just to try to keep my immune system functioning and healthy, I did go back. So it's not necessarily that everyone would need that many treatments. It's just being, again, like reinfected and for maintenance purposes.
So why did you specifically chose the clinics in Mexico rather than, I don't know, there are in Europe, there are several in Mexico. So what made you choose the specific ones you were in?
Okay, yeah. So the very first one I went to was in Guadalajara, and I went there because the woman that opened that clinic, basically, I wouldn't say she opened it, but she was sort of the liaison because she's an American and she had really, really bad long COVID. She basically went to Mexico. She thought she was like at the end of her life. She was in very, very poor health. She ended up getting stem cell treatments there, and she ended up like just recovering. I mean, I wouldn't say 100%, but her quality of life went from, I think I'm dying, to, wow, like I can help other people through this therapy. So that's the first place I went. So I know one of the questions was, why did you change places? So they were working with a specific doctor at the time that was very well liked, a beloved doctor. I did a video a long time ago with a patient called Beth Martin. We have like almost an hour video of her story, and stem cells helped her cognitively. I mean, they helped her so much. So she had went there, so that's where I went the very first time. It's far. I mean, it was, you know, not that far retrospectively, but I mean, it's a 3-hour plane flight. It's in the middle of the country, like lots of factors where it wasn't the most convenient thing for me. And then, like, to be perfectly honest, without like bad talking anyone, there were some negative things that came out just about how the business was being ran, about were we really doing things by the book, or just some shadiness was just going around. I didn't feel that I had, like, you know, anything with the therapy or anything, but just more like the business dealings that was happening. Some people were having some negative experiences. I was talking to people more about how they felt that they were being charged, how they were being treated, stuff like that. And I was like, you know, I don't want to be involved in anything like that. And then they changed doctors, and I don't know, it was hard to get information, if that makes sense. Like, is this a legitimate doctor? Is this really a nurse? Is this person have experience? Like, there was just little red flags. So I was like, I'm kind of just cutting that off. So then there is a Lyme clinic in the US, and they send mostly all their patients to BioAdvanced Medical, which is where I've been going. And I lived in LA at the time, so it's literally a 2-hour drive. So it was like, it doesn't make any sense for me not to try this clinic. And when I went down, there was no obligation. I didn't even know if I was going to get stem cells. I just said, I'm going to go down there. I'm going to get a consult. I'm going to meet with the doctors. If I don't like it, I'm just going to get in my car and drive home. It wasn't a big, you know, obviously when you're flying hours and you're taking major time off, you know, you want to make sure you're making this investment worth it. Here, just took a day off from work, drove down. I was super impressed by the clinic. They'd been there for over probably 37 years at this point. I met so many patients there that were like cancer patients, fibromyalgia, Lyme, you know, people who have long chronic multiple sclerosis, that they have to keep coming. Their conditions, you know, aren't going to, quote, go away. And they were like, we absolutely love this clinic. We've been coming here for 10 years. We've been coming here for 6 years. Like, everyone just had such positive experiences there. And so I decided to get my first stem cells done there, and they're very conservative there. They're going to give you small doses, which is good or bad for people that live far away. I live close enough. So it's like, hey, if I have to come back in 2 months, I'll come back in 2 months. But they want to see how you respond. They definitely are not about money at all, in the sense that I would say, well, I want more stem cells. They'd be like, I don't think you need more, but I want more. I came here, I took my time to come here. Can you give me more? But that's kind of a waste for you. Your body can only take so many stem cells at once. And then you have to nourish and feed the cells. This is how it was explained to me. So if you get, you know, some of these places that are like, we'll give you 500 million stem cells, they're like, your body can't take all of those at once. And then that's when you can have some of that mast cell reaction to the cells. I haven't heard that being very common, but I have seen a couple people in random groups say that has been an issue. Like, they've gotten so many. And if people who have, you know, issues with like histamine, mast cell activation syndrome, that they may have had more of a reaction to it. So I know that was like a long answer, but basically that's why I decided to go to BioAdvanced. And I just had such a great experience that I'm like, that's just going to be the place where I go. Because a lot of these places, and they're not very expensive considering. I mean, some of these places are like $20,000. You know, I've went there and, you know, I'll spend $3,000. I mean, I know that's not necessarily cheap, but compared to other clinics, it was more reasonable cost-wise as well.
So yeah, I thank you for the elaborate answer, because it's very helpful to distinguish between the two clinics. We didn't know there was so many different issues between this clinic and the other one. And you also answered along the way that, as I understand, correct me if I'm wrong, it is certainly not a one-time treatment, even if it's a series of treatment. As you say, people were coming back every, I don't know, but there are people that, like, in 10 years, they visit there for like at least more than one time for a series of injections. So it's not a treatment that it's like bang and go and you're all fully recovered. I mean, even for us, if someone decides to go, then he must take into consideration that might be a need to come back, like in a year time, in 2 years time, as I understand.
Right, right. And I mean, I think with long COVID, we don't really know, right? With,
Yeah.
you know, some of the other issues, fibromyalgia, multiple sclerosis, you know, those people are managing symptoms really because we don't, you know, unfortunately have quote cures for those diseases yet. So people will go and they'll at least get a quality of life, you know, and then they may have to return if they're in pain again and things like that. But like, as I stand right now, like, I don't feel that I have to get stem cells again. Like, I hope I never have to. I mean, I really do. I will though, if I do, if I ever need to, I certainly would go back. But I feel like now I'm at a point where, you know, I don't need to go back, if that makes sense. And like, hopefully everyone can get to a place where they don't need to keep going and keep going.
Mhm.
You did one treatment though, like in this clinic, or how many treatments you did there, and how often? Like, is it IV? How is it done?
How often? Is that what you said?
Yes, like first, is it IV or is it a shot? What is the form of the injection?
Oh, it's an IV. They only do shots if you if it's like an elbow injury or a knee injury or something like that. They will do it in that specific area. You know, if you have more of a sports injury. If it's for your like any kind of immune system, chronic disease or anything like that, it's IV.
So how many hours you connect to IV, and how is the process?
It's short. I mean, you just
Short.
I mean, you're probably maybe IV 45 minutes.
That's it.
And it's just to get all the, you know, it depends obviously how fast, you know, you specifically. I have a very, very large vein. I'm like, get in and get out. I don't need to sit here forever. If you have, depending on how big your veins are, how quickly you can handle it. You know, they do give you some vitamins with it. Sometimes they just give, you know, some like hydration stuff with it. So it depends how quickly you can get through the IV bag. But I mean, my husband flew in, and I mean, he flew in at night and went in and was there for 2 hours and flew back home. So, I mean, he doesn't have long COVID, but he went for an injury, but he also was like, I just want to get some through my IV because he's been exposed to COVID a bunch of times too. His immune system's been down. He's been more prone to sinus infections since he's had COVID. So he went for, you know, just his general health. And I mean, he literally was there for an afternoon. Now, the first time you go, they typically want you to go for 4 days. That's really what their protocol is. Like if you're a brand new patient. Once you're an established patient, you could go for 1 day. I normally will go for 2, but
so what might be the symptoms if someone feels something after the treatment? If there are any side effects, what might they be, or do they explain it to you?
And the biggest one is fatigue. The biggest one is you'll just have like a couple days where you'll feel very, very tired. I would say that's the only thing that I experienced there, and you just have to just understand that, you know, don't plan anything, plan to rest and take care of yourself, hydrate yourself. They don't want you to do any physical exercise. They don't want you to go in a sauna and like get really overheated after. It's just really resting. But I would say fatigue. I didn't experience any other symptoms. The very first time, I would say, because in Guadalajara, they give you a really high amount of stem cells, which I found out later wasn't really recommended to do that many. And I felt nauseous and a little bit lightheaded and dizzy, but it goes away within, I mean, a day or two. It's not anything that lasts long from my experience.
So how often you did these shots? Like, did you do how many times in general in this clinic? And what was the intervention between the time?
Yeah, they recommended about like 4 to 6 months in between. I went in, so I was supposed to go at the end of 22. So I went in May of 22. Well, that's just when I drove down, and I just went for a day. And then I believe I was reinfected over that summer, and I started to have a flare of symptoms again. And I went back in July of 22, and I was going to go back in December. They said 6 months. And then I got reinfected, positive COVID test, like the day before I was supposed to go. So I had to cancel. And then we said, like, let's push it out. So I went back in February of 23. And then I did go 3 times last year. I went in June and then I went in October. I probably didn't need to go in October. I don't know. I don't think I think I was well enough that I didn't need to go. But I think there's that fear again that sort of sets in. It's like, oh, let me just make sure, like I'm keeping up with things. I mean, you know what I mean? Almost like that preventative. It was more of a preventative thing at that point. But I probably didn't need to go back. But the recommendation is about 4 to 6 months. They really don't want you going more. Like I know someone that was going like every 2 months, and they're like, it's just not necessary. The stem cells can take up to 3 months to like absorb and do their thing. And if you're going too soon, that's also not really productive.
They say it can take up to 6 months.
Right. Yeah, I've heard different things, but it's at least like a minimum, of 3. There's really no reason to go before then. But like 4 to 6 months, I would say. So like when you're really kind of maybe going through it, maybe 2 to 3 times a year. And then after that, I mean, like I said, I don't really feel like I need to go back, but I wouldn't be opposed to going back either.
Is it legal in the US, like by the FDA, or because I know that some of the clinics are out of the US, like in Europe, so
Yeah, there's in Serbia, Swiss Medica in Serbia.
so
And there are
how come
some
that it's legal in the US, this clinic?
It's not FDA.
there are legal issues. There are legal issues with stem cells because they can't cultivate them. There's the FDA made a statement in number 361 or something, and it says that you can't cultivate stem cells because basically it's illegal. It's like
So how they let them do it in California? That's the question. If it's not legal, how
it
it's
wasn't in
legal?
California.
You can get stem cells in the US. They're just
It's not the exact thing because
right.
It's fat derived stem cell. They take it from your body and they're like spin it in some machine or something and get some amount of stem cells, but it's very mild. It's a very little amount, and it's like it's up to sum of stem cells that they say, like number of stem cells 100 million or something, but it's not true. Inside the solution they give you, it's like 10,000 stem cells or below that. It's not like the real thing. It's like in orange juice, which is not from orange. They write it's in flavor of orange, but it's not made with oranges. So you have a little bit 1% of oranges. It's the same thing in the US. You don't get the same stem cells, the same amount they actually mention.
Well, they freeze them here as well, so that's the biggest difference of when. So they do get them from like babies, basically. Like they can get the mesenchymal stem cells, but then they take them and then they're put in a freezer. So when they're thawed out, they can die off in the process. So as you're saying, you can say, I'm getting 100 million stem cells. Well, once you freeze them and they thaw, how many are you really getting?
And there's difference between fat-derived mesenchymal stem cells and the umbilical cord mesenchymal cell cells. They're a bit different in their potential to heal. And also, when you freeze them, a lot of them die. So they give you something that is like stem cells, but it's not stem cell. You should not freeze them at all.
So Jacqueline, did you get it from a donor, from a placenta? What's the origin of these stem cells?
Right, yeah, they can be a combination of umbilical and placental as the ones I used at BioAdvanced. Yes, and they're donors that are screened. So they, do like a screening process of, diseases and things like that, so that they can make sure that the stem cells are healthy.
Do you get
it's not from people that
do you get a quality? Do you get a quality certificate or something regarding their quality assurance or something like that in Mexico?
You can actually, interestingly, in Guadalajara, they do give you some documentation and things like that. I'm sure you could ask for one. I didn't get anything at BioAdvanced in that way. I guess Some of it was just trusting the clinic and the process that they do there, but I'm sure that you could ask for that no matter where you go.
And Alex asked if there's risk for cancer in these stem cells. Do they explain that in the Mexico clinic?
Well, there have been studies like the embryonic. There are certain cells that they say can lead to that, but actually a lot of these cells actually fight cancer. I mean, people were going there for cancer treatment and noting their health was improving and their cancer, like someone was told in the US that they had like 6 months to live. And the guy went there and it was 5 years later and he was getting stem cells for cancer treatments because in here they basically were like, well, there's nothing we can do for you anymore.
Oh, wow.
Yeah. So, it's been interesting to meet everybody. You meet so many people there and they're, very willing to share their stories and stuff with you.
So I'm trying to understand what is the difference from the stem cell that I got after the apheresis. Actually, if it's the embryo stem cell, so it's supposed to be almost the same thing.
Yeah. I mean, I don't know. I'm not sure what you got exactly. And I'm not sure. I mean, I can say, I researched to a certain extent, and then a lot of my decisions were just instinctual, like prayer and just belief and just guided by, and I don't want to say I didn't put much thought, but like the monoclonals, people are like, oh my God, weren't you scared to get monoclonals? And I was like, no, it was just, I feel this is right for me. I'm going, whatever. Like, I'm in such a horrible place anyway. Like, not that anyone wants to get worse, but a lot of intuition has guided me throughout this process. So if something, and what's crazy is looking back, I had so much doubt about getting vaccinated. I had so much like, am I sure I should do this? Is this the right thing? And I went out of fear. So after that, I was like, I'm not going to let fear dictate my decisions. Of course, you have to research. Of course, you have to be aware of what you're doing. And you can't just go to some random place in the middle of a foreign country and have no idea, where anything's coming from. And, with no reputation or history about the place. Of course, you have to be mindful of things. But I think I got to a certain point where I was like, I'm going to let my intuition guide me. And I'm going to let, my belief in my faith help me to make the right decisions for myself. So sometimes, it's interesting because even though I have a lot of knowledge about things, when it came down to it, it wasn't always the knowledge of things that led me to my decisions. It was more of like, I instinctually feel this is right for me and I have no fear on making this decision. And I think if someone's very fearful or doesn't feel something's right for them, I don't think they should do it. And I've had friends that have reached out, like people I've become very close with. They've been like, I'm scared to do stem cells. Do you think I should do it? And I'll say, no, I don't. If you're that fearful, then maybe there is a reason why you shouldn't do it, because not everything's going to be right for everybody either.
I was thinking maybe, I don't know, maybe, will it be okay to ask you, did you get to know somebody there in the clinic that suffers from small fiber neuropathy that we can talk to? Or do you know if there is a contact that we can contact with that has
at the clinic?
Yeah.
Yeah, well, there's a US phone number that you can call, or I think that's the best way. Because so what happens is if you email the clinic, that they are in Mexico, they speak English fine, but like they will get back to you in like 3 to 5 days and they'll just say, yes, like we can help you, blah, blah, blah. Like they might not give you the information that you need, but when you call the US phone number, you can kind of talk to someone and ask them questions and get things answered. Because that's what I did first before I went, because they are very busy and they're not really set up. They don't really do consults prior to. So that would be the best route, I would say, if you had specific questions.
Okay.
Did you
or maybe I can find an email that's in the US, because I feel like those people are just easier to, that's just their job to get back to you right away. Like the people in the clinic are just there to make appointments and get people on the schedule and arrange that kind of stuff, where the people in the US are more available to answer questions.
Do you know more people that did stem cells for long COVID specifically and it helped them out? Like, have you heard about more study cases? like yours?
Yeah, I mean, I'm trying to like just go through my brain here of everyone I know. Like Beth had amazing results. I went with a girl named Carrie, and it definitely helped her, but she has really bad Lyme. So like that was also something that was affecting her. But she saw positive results. There was another person that actually went to Guadalajara and went to a doctor that I had recommended, and he had contacted me that, you know, he was doing well and had, you know, had seen benefits. But I would say like I have to really follow back up with everybody at this point. It's been a while. So I couldn't say for certain how they're doing right now, and you know what the overall consensus was, because that was just, you know, at that moment in time when I had touched base with them.
Yeah, we don't hear about many cases like yours because first it's expensive and not everyone has this the courage to do this and the knowledge to do this. And I've talked with another person named Costa, who's done the clinical trials with stem cells in Hope Biosciences, if you heard about them. And I've like followed him up and spoken the entire year with him, like on and off. And he says that he's fine now. He's actually back to normal. There are little bit small fiber neuropathy in his head. Sometimes, very, very rare, but he's back to normal basically.
Yeah, so I guess I had talked to Hope Biosciences way back when, and they had just all they had was 10 people in their trial. That was all they were allowed to do at the very, very beginning. And there's someone I believe he probably still works there. His name's David. And I talked with him, and he said out of all 10 people, every single person had improved, and like 8 out of 10 were back to complete health after they did the trial there. And there were 2 people that were still had improved, but were still having some lingering things going on. And then they did another trial, but with their other trial, the FDA required them to have a placebo group. So he had talked to me, and I just said that, like, even though it'd be like maybe cheaper, I still have to pay to fly to Texas. I still have to pay for, you know, for a hotel, and then I could be getting saline. So I'm like, it's not worth it for me to travel to Texas 6 to 8 times and get a placebo.
Yeah.
But I would definitely look up and see. They may have the results of those trials now, so it would be interesting to see what those are.
I actually saw the results and they seem pretty good because they say that they do improve in their metrics, but like they don't follow them up to half a year, because it takes about half a year for the stem cells to do their job. So they don't follow them up too much. It's like they follow them just a little bit. They say that they improve, but it's not like something that certainly gives you the idea that it works, because the follow-up is very, very short.
Okay.
So,
Guys, do you have any more questions?
יש לנו את מיכל פה.
Did someone ask another question that we didn't see?
What did you want to ask me, Daniel?
זאת מיכל הר, נכון?
Okay.
יופי. מיכל is a doctor who also knows the condition of the autoimmune dysregulation. And I've spoken with her for about an hour and a half about this topic. We every one of us agrees that there's something going on. It can be caused by the vaccine, it can be caused by the virus, but there's some shift that's going on in the immune system which attacks us from the inside because of this protein. And what you have done, Jacqueline, like it makes a lot of sense, because you got the monoclonal antibodies, you got the stem cells. They're both immunomodulation therapies, I would say. And maybe it shifted you in the right direction. And since then you feel normal. And that's what I suspect that is going on with the stem cells. And also I put a pinpoint on the monoclonal antibodies because they're also very important. And it seems like it's the way to go, what you've done, because we don't hear about people that improve. Nobody's improving. All of us are like in plateau. We're the same, but it's bad to be the same. We always have the symptoms. It's not going away. Some of us here have this for 3 years. Some of us, I have it for 1.5 years. It's not going away, and it's really debilitating. Like, it's very bad to live with that, because you can have all out of the sudden brain fogs, neuropathies. You can have post-exertion malaise. Suddenly, post-exertion malaise, your heart is racing. It comes out of nowhere. It can like, I can be normal now, but tomorrow I can wake up with many symptoms, and it will be very debilitating. So I really this discussion was very important for us, because
Thank you so much. Yeah.
we need to
Appreciate it.
target the
Well,
immune.
Daniel, I just want to mention one thing. Where's what I explained to you, and I can explain here because I don't want you to have too much hope in that sense. As physicians, we're still learning this. I mean, there is a difference between a patient and a physician. Patient
Dr. Michal, we can't hear you.
is those problems.
Can you, Dr. Michal,
And
can you
especially
please
in Israel, we have a healthcare where patients get the treatment they need for free, but it has to be, there must be some evidence for its efficacy. So that is, I mean, when you're a patient, like Jacqueline, what Jacqueline did, she basically decided to take responsibility for her own care, and she looked for someone that can help her. And I think that's, and she didn't look for someone to solve her problem, right? She didn't go to her GP and say, okay, find the treatment for me. And that is what I try to explain. As a patient, you can do whatever you feel is right for yourself. As a physician, you take responsibility over the life of someone else. And if you want that person to receive treatment by the system, you need to have proof for its efficacy. And in that specific, for instance, if I want to give IVIG to a patient with immune thrombocytopenia, there is a lot of evidence for the efficacy of this treatment in this disease. I know how to diagnose it. I can write a prescription, write the diagnosis, and then the patient will receive this treatment with no problem. But if I want to give IVIG to a patient where there is not enough evidence, even if for some patients it might be helpful, it's much more difficult to get this approval from the system, even if you as a physician think that it's the proper treatment, okay?
Yeah, the
So
problem
there
with
is
our
a difference.
system.
In America, there is a private system.
Yeah,
In
but
Israel, there is a public system. There is
but
also a private system, but
the problem
it's
with our
mostly
system
public.
does not even do clinical trials with that. It does not even come to the point where it allows itself to do some clinical trials to prove the point.
A clinical trial, like Jacqueline said, in order for a clinical trial to be useful, you need to have a group and a placebo group. Now, if they did a clinical trial in the US and it is now approved by the FDA for a certain disease, then many times in Israel, it will be quite easy. You know, if for instance, now there is a new treatment for leukemia, and it's been approved by the FDA. In Israel, it will not take much time before it will be approved also. But I did not see approval by the FDA for this treatment. That's a problem. So when there is no approval by the FDA, you need a lot of money in order to make a trial. And you need a physician that can organize it.
Plus
And you
the,
need diagnosis, and because if I just say I want to give stem cells to 20 people, but one has cancer, one has this, one has that, you can't reach any conclusions. You can only maybe say it's not causing any damage, but you can't talk about efficacy, right? So it's a problem. I mean, it's not the problem in the sense that someone doesn't want to help. It's a real inherent problem in the system. And I think that, by the way, one of the things that sometimes moves treatments is if there is a large group of patients or a relatively large group of patients that have the same disease and they put pressure on the system. Okay, they can have like amuta or like an NGO or something.
Yeah, we don't even have a diagnosis yet. Yet we
Right,
suffer.
and
But
and
we-
that's exactly
And
so.
also the FDA banned stem cells. They banned the cultivation. So what you're talking about, who's gonna give you the treatment? It's probably now illegal to do that, right? Illegal to cultivate.
I don't know. I worked with hematological stem cells. We
Yeah.
did stem cell transplantation, and it's not trivial. Okay, it's not trivial to harvest them. It's not trivial to save them. You can do it from autologous, give the patient their own stem cells, like you said, or you can have umbilical cord. It's not trivial, and there are complications for this treatment. So
Yes, so basically what you're saying, the system is so complicated that we need to try things out like Jacqueline did because we don't have anything else to do inside the system. It will take too long and we will keep suffer. Basically, that's what's going on. That's the truth. Like we try to knock on the door of those who accumulate all the long COVID cases. We try to knock the door and ask for something to happen, but we don't even have diagnosis. We're just hallucinating our things. That's what's going on. We're all hallucinating neuropathies and pains, and so we will keep knocking on this door. It won't open because we're not even diagnosed with nothing. So we've got to try it ourselves at this point.
Yeah, well, I know here they've been having hearings about it, but the problem is just, when is that going to result in an effective treatment for people? They can have, they had recent, like our government get together and we're going to put X amount of dollars toward long COVID, but okay, what does that mean for the people that are suffering now? What's that timeline look like? So it looks like they are trying to find solutions, but it's just, again, the window of, okay, these trials, but getting that approved for people, then making it accessible for people. It's just, all that stuff is so up in the air. And, like the doctor mentioned, there is, for the doctor themselves, they want to, there's certain things they just can't do, right? It's just like she said, you have to have proof, you have to have evidence. And so I did take, matters into my own hands, and sometimes that can pay off and sometimes it can't. Fortunately for me, it did, but it was all at my own risk.
And that's what I think is going on. We have to take our ourselves in our hands because we don't even have diagnosis.
Right.
We will keep fighting a wall at this point.
But it was very encouraging hearing your story and the way you went through all the difficulties. And I really think seeing you and feeling your energy now, it is encouraging because we don't know you, we didn't know you prior to this conversation, but I feel the energy. I feel you have the energy to do things. I'm sitting here at 9 p.m., in the evening, knowing that tomorrow I will probably be in severe fatigue for several days, just because I was doing more than one thing a day, listening to the Zoom and doing another thing an hour earlier. So you gave us a lot to think about. I really believe that.
Oh,
And
well, you're welcome. And just like a real quick story here, when I had went out from, working out very, very high, level for myself. I don't want to act like I was a high level athlete or anything like that. But I could, work out for solid hour and a half, high intensity. And then when this happened, I had a few resistant bands. I went in my garage and I did maybe a few pulls on the resistant bands. I ran to the sidewalk and back, and I was like, I can't do anything else. And I literally was like, I can't even jog to my sidewalk and back and do some resistant
I
bands.
pick up my dog and it feels like exercising. Like I hold him up, my heartbeat is going fast, and then I'm exhausted again, and I literally didn't do nothing. And I was cycling 50 kilometers before all this. I could do whatever I want. I always felt healthy. I'm not the person who went to doctors. I'm not the
Yeah.
guy.
No, I know, and it seems like it's very true for so many people that ended up with this. But anyway, like now, I mean, I can work out for 60 minutes, 70 minutes. I can take my kids to the park. I can play basketball with my kids. Like, so I just hope that if anything, that there is hope, because there was a time when I literally thought I would never exercise again. There was a time when I thought, like, is this better? Like, do I even want to be alive? Like, and I hate to go down that route, but that thought crosses your mind when you're at the bottom of it. So like, I hope that just gives that can give people hope that things can get better, things can turn around, and just keep searching for answers is really what I tell people. Just keep searching and find what comes across your path that you feel is going to be right for you, and just have that faith. And also, I hope you all are safe. I don't know, like, I don't know. I only see what I see, obviously, on our news, but I hope that you're all safe where you're at. And I know there's a lot of other things going on in the area and out in the world over there that I'm sure can cause stress.
That certainly raises the bar for neuropathic and all sorts of other pains. Yeah. Thank you so much for your kind
Well,
words. And
We really
we
appreciate
appreciate
it,
your
Jacqueline.
time.
We really appreciate it, and like really wish you to continue in a good health and continue encourage other people. It's very important to give hope.
Yeah.
Yeah, and
Well,
I
thank
think
you so much. You're welcome.